Good afternoon, everyone. It's a pleasure to be here again at the fourth IDS Summit. I've been attending this every year, and I think the audience is growing, and it's really wonderful to see everyone. Okay, I'm too short for the podium. Okay, much better. So I'm going to start by showing you this picture, which you can see, and this is pretty much sums up what men and women think of themselves. So you can see what the woman sees herself when she looks at the mirror and what the man sees when he looks at the mirror. And that sums up what some of us feel about ourselves. But let's talk about what exactly happens with men and women. So I have no relevant financial relationships, and the funding sources for all the research that I'm showing you now comes from the National Institute of Health, grants that were funded, awarded to me and to my colleagues at Mayo Clinic, American Diabetes Association, and support from the Mayo CCATS. So the worldwide prevalence of both glucose intolerance and type 2 diabetes is rapidly increasing, as we all know. The mechanisms responsible for this remain an area of active investigation. So the effects of sex on glucose tolerance, which is the contribution of differences in insulin secretion and insulin action on carbohydrate metabolism, were not extensively evaluated. So that was why we did this study, and we did this many years ago. And all this is published data. You can find this in all the publications that are listed on the slide. So I'm going to focus my talk today, which is very short, 20 minutes, and Dr. Unnikrishnan wants me to wrap it up even faster. So I'm going to give you the, the big picture, and then you can read up the rest. So it was 120 men were studied. 90 of them were over the age of 65, and 30 young people. The definition of elderly has changed, so I don't like to call them elderly, but for this study, they were referred to as elderly. So no offense to anybody over 65. 90 women, 60 of them over the age of 65 and 30 young, between the ages of 18 and 30. Labeled mixed meal tests were provided, and labeled IV GTTs were done. So these were all non-diabetic healthy men and women. A mixed meal containing 45% carbohydrates, 40% fat, and 15% protein, with 75 grams of glucose, the so-called jello meal that we used at Mayo Clinic for many years and continue to use at UVA, containing 113C glucose was ingested. Glucose, insulin, and C-peptide concentrations were measured prior to and following food ingestion, and we measured rates of meal glucose appearance, endogenous glucose production, and glucose disappearance using the triple tracer method, and used the two-compartment model of Radzwick to look at the fluxes. So this is a cartoon of the triple tracer meal method. We give infusions of isotopes, 6,3H glucose, which is a radioisotope, and that is given with the first bite of the meal, and it mimics the anticipated meal appearance, which is shown in yellow, and the blue line is dyed deuterated glucose infusion, which is started approximately 2 hours before we give the meal to measure basal rates of glucose production, and then we turn it down to mimic the anticipated fall in endogenous glucose production. So for healthy people, when we eat a meal, glucose production is suppressed in the liver. So that is what we are trying to mimic. And again, the publication is listed. Feel free to take a picture and you can read about it in details. And we used a couple of models which were described by some of my colleagues, and we were part of many of these models. The insulin sensitivity minimal model, which uses OGTT or a meal, and it takes into account what happens when food enters the GI tract and goes into the liver as well as the peripheral tissues. And we also use the insulin sensitivity hot minimal model, which was the first model was described by Bergman and Kobeli way back in the 1980s, and then we did refinements of it with the help of Dollerman and Kobeli and Andy and myself in the 2000s, where we put in isotopes into this. So the G stars, wherever you're seeing G stars, that signifies the label or the isotope, and we can then quantify what's going on with this meal. And I will not go into details. The C-peptide is used to look at beta cell responsivity. So the meal minimal model has some indices that we look at. Phi total, which is the global index of insulin secretion, and it is the sum total of phi static and phi dynamic. Insulin sensitivity is denoted as SI, which provides an index of net insulin action, and it's a measure of the ability of insulin to suppress glucose production and to stimulate glucose uptake. If you look at disposition index, it's a measure of beta cell function appropriate for the degree of insulin resistance. So these are the indices that we utilize with this trial design. Now look at this slide which shows the subject characteristics. As you can see, the age is appropriate for the elderly. They are over the age of 65. And the young people, the average is about in their early 20s. We had 86 elderly men, 59 elderly women, 30 young men, and 28 young women who completed the trial. This was actually a 2-year trial. I'm showing you baseline data. The 2-year trial is of no consequence to this conversation. If you look at the lean body mass, and you'll see the striking difference between women and men. So you see men are more lean, so their lean body mass is in their high 50s, and women are less lean to start with, and body fat percent is much higher in the both elderly women and young women as compared to the counterparts. So does glucose metabolism differ in young men versus young women, and elderly men versus elderly women? That's the question that we are all interested to know as we are getting older. And I show a picture of the hospital where these studies were conducted. So if you look at this slide, it shows glucose concentrations on the top panel, insulin concentrations on the bottom panel. And what I'm showing you is the difference between young men and young women. Remember, they are all the same age group. But if you look at this graph, you can see clearly that glucose concentrations seem to be higher in younger women as compared to the young men. And if you look at insulin data, insulin concentrations are higher in the, lower in the women versus the young men. So this is the same meal, they ate the same meal, same age group, etc., but there's a difference in glucose tolerance. If you look at C-peptide, again, you see a difference. The area under the curve was highly significant between men and women, and glucagon, not any different. If you look at meal appearance, this was calculated using the meal minimal model. Again, meal appearance was different between men and women. As you can see, the red lines are higher. And if you look at glucose production, this is the most striking thing. Basal glucose production significantly higher in young women as compared to young men, and they suppress less. So this is the hallmark of what is developing between young women versus young men. And if you look at glucose disappearance, striking difference, young women have less glucose disappearance as compared to young men. So, and a picture is emerging in your mind. Now let's look at what happens as these people grow older. So that was the young people in the early 20s, and now we're looking at people who are in their mid-60s to, we went up, the oldest person we studied in this study was about in their mid-90s. So if you look at this data now again, you see that there's a difference between fasting glucose in the elderly men versus women, and area under the curve was highly significant as well. Look at the pattern in insulin, the bottom curve. As you can see, the yellow line, elderly men, much lower than the elderly women. Now they've eaten the same meal, but they are not able to put out as much insulin as the other group. C-peptide concentrations lower in the men in yellow, and glucagon is not any different. Now look at the fluxes. Meal appearance is much lower in the elderly men, and glucose production, if you look at the baseline, basal glucose production much, much higher in the elderly women. This is the same that I showed you in young women versus young men as well, that basal glucose production was higher in the fasting state and the suppression was lower. Glucose disappearance, way, way lower in the elderly men. So as the men were growing older, glucose disappearance was much lower, and when you saw the younger ones, it was the reverse. It was much lower for the women. So now this is an index we use, hepatic insulin extraction, to say how much of insulin actually showed up in the periphery to be, which is not extracted by the liver. So if you look at this, in both elderly men and women, hepatic insulin extraction is much higher than when they were younger, which means less insulin in the peripheral tissues. So now, moving on to, does insulin action and glucose effectiveness differ in young women versus young men, and elderly men versus elderly women? This is net insulin sensitivity, which is on the top panel, And if you look at this, and effect of insulin on glucose disposal, both are lower in young women. So remember, they're the same age group, but it is lower. SI, net insulin sensitivity lower, and effect of insulin and glucose disposal, both lower in the young women compared to the young men. If you look at glucose effectiveness, it is again probably slightly lower, but numerically, but not significantly for net. And if you look at the effect on glucose disposal, which is the G star, that is definitely different in the young women, so it's slightly higher. So mixed data. Net insulin sensitivity is higher in, now this is elderly. So if you look at this, not, I wouldn't say statistically different, so numerically maybe slightly higher in elderly women. And as far as SI star goes, which is the effect of insulin and glucose disposal, which is in the peripheral tissues, not any different. Glucose effectiveness, again, not different in the both groups, maybe numerically slightly higher in elderly women, but as far as G star goes, which is the effect that glucose has on glucose disposal in the peripheral tissues, significantly higher in elderly women. So now, I'm going very fast because I've been told to go fast, okay? So I apologize for my speed. Does insulin secretion differ in young men versus young women and elderly men versus elderly women? So now we are talking insulin secretion. So if you look at this, top panel, there's 4 lines, that is phi dynamic, and the bottom is phi static. So these are dynamic and static indices for insulin secretion. And if you look at the elderly group, compared to the young, and if you compare elderly men, which is in blue, versus the young men, which is in pink, you can see that young men have much higher insulin secretion as compared to the elderly men. And if you look at the young women versus the elderly women, it's slightly higher, maybe slightly different. So you should start thinking about what is developing as I'm showing you these slides. If you look at phi total, elderly men versus young men, definitely there's a difference. Young men are putting out more insulin, and elderly women versus young women, there's a slight difference as well. Disposition index, which is the index of insulin resistance. If you look at this, there's absolutely no doubt in your mind that disposition index is different as you compare elderly men to elderly women. And on the other side, the pink versus yellow, young men versus young women. So look at the difference as people are getting older, what is going on. So to summarize the effects of sex on glucose metabolism, meal appearance appears to be higher in elderly women versus elderly men, and in young women versus young men. Glucose production was no different, I showed you. Glucose disappearance is higher in the women versus the elderly men, but it was not so in the other group. Insulin action was lower in young women as compared to young men. Insulin secretion, no different. Glucose effectiveness, much higher in elderly women as well as young women, whereas disposition index higher on the elderly women versus elderly men, but lower in young women versus young men. So a lot to take in, I know, but you can read about it. So now somebody would ask, why did you only study people over 65, 70? What about the middle-aged people, which is half this audience here, right? So this is some unpublished data, and I just want you to look at it, and we have, just see, there's a small n, so I wouldn't put too much importance into it, but this is just to show you, these were N of 22 pre-diabetic middle-aged men and pre-diabetic middle-aged women, and their ages were in their late 40s to early 50. BMI was high, 31, 33. Body fat percent, again, same picture emerges here, that pre-diabetic women had higher body fat and lean body mass was much lower, you can see, as compared to their male counterparts. And if you look at insulin sensitivity calculated on the left panel and insulin secretion on the right panel, you can see the differences. So in middle-aged women, insulin sensitivity was higher, but insulin secretion for middle-aged women was lower. So there's a little of a disconnect here. But again, as I mentioned, small study, unpublished yet, so there needs to be more research on this. So to conclude, young women and perhaps elderly women are more insulin resistant and young and elderly men respectively. Regulation of postprandial glucose metabolism, as I showed you, differs in men and women, and effectiveness of therapies which would be aimed at regulating glucose metabolism may also differ in men and women. So thank you for your attention. A lot of people helped me to do this work, so I've got a picture of all of them, and this is my team that I had at Mayo Clinic when I did the studies, and I've moved to the new institution, and that's University of Virginia. Thank you for your attention.
Thank you, Dr. Basu, for a very interesting presentation.